It's touching.
It was not selected the user. You have to use
You have to
standard
select the user first,
and
then
then
move it.
Yeah. So you can move it down, and then if you use it for 1 minute, then you have to give it 9 minutes rest, because there's a terminal cutoff on the unit. So if somebody uses it up, down, and then you find the unit is stuck for a certain time.
Mm-hmm.
So that's why it's like this motor will work for 1 minute and then you give
9 minutes rest.
So usually you bring it down to whichever position you want in 10 to 15 seconds, because it's just either up or down. Like some people, I mean, especially in the government sector, they're not bothered. They will operate up, down, and then you have either the motor going defective or some electronics. So, and you can see here, let me bring it. Now you have, this is called, this is the magnification factor, this is the focal, and this is the light intensity. Let's concentrate on these three, since I'm bringing the OMI microscope. Now if you look here, these are the hand grips. You have a green button. I can move the microscope this way also, but these, if I press on this, you can hear certain clicks. Mm-hmm. They are magnetic brakes. See, now I cannot move this in any direction. Of course, if you use force, it will move, but it's not recommended, because you have brakes for each and every joint. So if I press this, you can hear a click. Mm-hmm. That means all the brakes are released, and it becomes, see, with a single finger you can move, because the doctor is already busy. You don't need him to put extra force and use this items. So this is the brakes button. Yeah, you can use either right or left, depending on whether the doctor is left-handed, right-handed. And there are drapes. You get drapes for the whole unit, or only you get a vision guard, so it doesn't splash on the binocular. You can see here the lens. Mm-hmm. So especially during dental surgery, you have the splashes and everything.
What is the vision guard? Do we have it?
Yes, I think a set was given. Vision guard was provided, isn't it? Drapes. I think Manasir would have it. As starter pack was given, some 20 pieces or so. And out here you have 4 switches. So these 4, the blue and the yellow ones, can be programmed. This for individual doctors. So usually the bottom, the yellow ones, it is not a hard and fast rules, but it's usually programmed for light intensity. To decrease, increase the light intensity. Okay? And the top one can be used for other functions. Like now, you can, if you press this, you can have click a photo if you have an internal.
That's the for the blue.
This thing. And these 2 are dedicated. The rocker switch, we call these rocker switches. They are dedicated switches. You can see this one is written F and other Z. Mm-hmm. F is for focus and Z is for zoom. Okay. So if you look at if you have to look through this, please you can take turns and
they played with that. I showed them.
Okay.
But I didn't know what the buttons were for. The yellow one.
Yeah. But these 4 are freely programmable.
And we can do it through here.
Yes, I will come to that on the screen. Now, why I told you to concentrate here is as I move the focus, you can see this changing. It goes up to 410 millimeters and minimum is 200. This is one way for you to check whether the switches are working or not. Before the doctor comes, at least once a month you have to check it. And this is the magnification factor. As I move the zoom, you can see this is changing and this is changing. Okay. See this, the outer one, we can change depending on individual doctors. That's why we have 3 settings. But we have kept it as standard. This one is to decrease the outer. You can see the light intensity decreasing from 5%, and the inner one to increase the light intensity. Okay.
And the dial is just to control the light field.
Yes. This is, and here you have the, you can see the light field is increased and this will be decreased. And if you move further, then this is minimum. And also you have a filter here. Light for when you're using the light.
What about this?
Yeah, this, I think this they use it when they use dyes. Radioactive dyes.
Oh, okay. Yeah, for cracks.
Yes.
Yeah, okay.
And this the, usually the doctors use the yellow.
This is only for cameras, for people?
This one is, this can be programmed, yes. One is for the camera. Sometimes the unit comes with the, you can order with the internal camera. And with that,
sometimes you put an
external camera. The advantage of external camera is this camera can be detached and connected to the other unit also. So different doctors can share it. And if you have a newer model, you can change it. Or the advantage is you just unscrew here. You can see the open.
Yeah.
And if a doctor has his own camera, you can bring it and plug it in and use it.
You can use any SLR.
Yes, that's right.
All connect
to click the.
As long as it's adaptable to this one.
And of course, yeah, Canon, different. You have the adapters available. You can buy the adapter and each. And the university, each doctor has his own doctor.
Yeah, they just switch the camera or switch the memory card.
And this is, suppose the focus here stops working for any reason, maybe 5-6 years down the line. So there's a manual.
Okay.
Or sometimes the doctor finds like this is moving too fast. So fine focus he can do with this.
Now what about these dials?
Yes, that's these are the most important. These knobs and how to change the lamp. So you cannot. This lamp is this thing, xenon white light. Okay. We have programmed the top inner button to light on and off.
The blue?
Yeah, the blue one. Oh. Yeah, you can write it down, it can be changed. I'll show you how to
let them at least know what it is now, so we can change it whenever we want, according to the doctors. But now we'll play with the standards.
Yes. Now, the important thing is, now suppose during surgery the light fades. They say the lamp is for 500 hours, but you know, anytime there's a small fluctuation, anything, maybe the lamp will fuse. So you have to change over to the backup lamp. And this is important. The main thing, balancing and changing the lamps are important functions of the this thing. Yeah, immediate. Because other things, if this is not working, nobody can do. Maybe you'll have to ask Manasseh or us to come in. So how do you change the lamp? If you see here, please come that side. This is called the lamp housing. Okay, you have two lamps. Now it's in the primary lamp 1, and then you can switch over to lamp 2. Okay. So how do you change? So if you try to change here, it doesn't move. Yeah, it's here, steps A, B, C. Okay. A, press this button. This whole thing comes. Don't worry, it will not come out. Okay. It will not fall. There's a safety device. And B,
Then
rotate. See, now it's important, this is fully out. You can see when it rotates, it's bigger than the housing. So that's the reason. Don't worry to pull this. See, change over to the position. And when you change over the position, you can see here a notch. Okay? This one. See, and the groove. The groove should be at the center of the notch. If it's slightly tilted, see, you try pushing, it will not enter.
Okay.
And you have a patient here, and the doctor is busy. Suddenly, light goes, and everybody is in there. So you have to make sure it is at the center of the notch. Okay. And see, then you just have to slide it in. And now it's in the lamp number 2. And at that time, when you switch over to lamp number 2, for this thing, you can take a pin and reset this count. Because lamp 1 will be for 500 hours. It works more than 500 hours, but at 500 hours, when it approaches 500 hours, we say the light intensity reduces by 50%. So you might have light, but the doctor will say the light is not bright enough.
How do you change the light?
Yes.
Itself?
That
to be done by us or you?
No, it can be done by anybody.
Okay.
If you
leave it to the professional, but we just wanted to know.
Yes.
In case
usually what most of the centers do now, it's new. So when you're switched over to lamp number 2, because this is xenon and it's hot, so you have 2 clinics. They usually buy one complete module, inclusive of 2 lamps, and then you can start buying individual lamps, because now this is hot, and once you just need to have something sharp object, and you can see an arrow here. So you just have to press some inside, and this whole thing comes out. You can see there's a lock here, this notch. That's why when you pull, it doesn't come out. When you press here, the lock is released, and then you can bring this module. What happens is, they have to remove the screw and change it, all this. So it cannot be done immediately. So you can have a spare module inclusive, and so when it's like for the 2 rooms, you have 1 spare module, and then you can buy individual lamps, because buying a module is more expensive than buying the lamps. But as a backup, all of them keep 1 spare module.
Just in case.
Just in case.
Which will have only 1 lamp?
2 lamps. The
module.
Module also comes
So
out.
because you're depending on it as like a spare. So you can
it's
use
a
it for
spare.
a couple of hours till you get the other one ready.
Yes. Or you can use that, and you can prepare this one as the spare. You can change the 2 bulbs.
Which we didn't order.
after 1 year, doctor, like 500 hours is quite a long time.
I know.
But
no, but it's just I need to know if it's in
Yes.
stock because I need to put the codes in the itinerary.
yes,
So whenever
yeah,
you want to
one
order-
lamp module. One lamp module you can order, and whenever the your lamp module gets over, then in the future you can just order only the lamps, any individual
Put
lamps.
it as like put it for the store, one lamp module, and the individual lamps, the codes. So when we need to order them, we can order them for the microscopes, and also the housing. What is it called? The cover, the covers.
That's no,
The
the
drapes.
drapes.
Drapes for the handles and the lens.
Yeah.
These I need the codes for them. I need them to be in the store.
Handles
So,
and rails.
He will. Abdul Wahab will be happy to code those for you.
Rails.
Yes.
عشان نحطهم بالitinerary
Huh?
program. They go
Rails.
and go just an order
Handles to
online,
rails.
in dinner,
Yeah.
and they will call you. So
Yeah. So
Drapes.
once
Yeah, drapes, handles and
this way it's easy.
The
And
lens.
they order through a computer system. You might on the store. So once they see anything, they will
or
just.
see now, suppose you have a new module coming in. It's simple. Now let me put it back to lamp number 1. See, it's lamp number 1 because 2 is brand new. You don't want to touch it as of now, and you just slide it in. It's as simple as that.
then it automatically will lock.
Yeah.
What about this 011 dial?
Yeah. This is a filter. You can change the. You can have additional filters. Let me show you. See, if sometimes you can order a blue light filter.
For the eyes and all that.
Yeah,
Okay.
yes. So when you bring it to 1, you can see there's a circle which is moving.
Oh.
Because in that is used mainly in ophthalmology and all this. So anytime you need an additional filter, because out there we can incorporate only 2 filters, yellow and that is yes, extra filter. So we'll put the filter here, and when you bring it to 1, it slides into position. The third filter. Because this module will, this arm is similar to the one used in ENT, the S7 arm. Only changes are this OPMI, operating microscope. This is Pro-Ergo, and when it comes to ENT, it changes to the different. Okay. Any questions up to now?
Everything so far clear. Clear for you?
Everybody passes with distinction. Then we have a test.
What is this
Good.
one?
Yeah.
This one is the
You want to
warning.
ask any questions?
Yeah, this is just a symbol. This is not for ophthalmology.
Ah, okay.
Like right now, we have shown that filter is not in place, so that's why they put this. This is not for ophthalmology.
Not for them.
Yeah. Now is another important thing which you should know is balancing of the microscope. Right now, see, if you keep the microscope any position, it stays. Sometimes you find the microscope coming down or moving down. That is done by this now balance. Before that, see now right now this movement is okay. Yeah. Some doctors would like to have it little loose. Or this is the friction now for this axis. So if I loosen this, you can see it will move too much. It will not. And then I tighten this a bit.
Like the old microscope.
Yeah. Most of the concepts, microscopes, the concepts are similar.
No, they are used to the old one. So
yes. And this friction knob is for this axis. If the doctor comes and this axis is too tight, then you do this. So each axis has its own friction knob. And this, of course, is for this movement, which and right now the most important thing is up and down movement. You don't want this to come and hit the patient. If the let me remove Right now it's balanced perfectly because it was. Let me just disturb the balance. Okay. Now the doctor brings it in position, but it's going back. Okay. So that up and down movement is controlled by this balance. So if you find this microscope going up, then you have here a plus and minus. So you increase the weight so that it doesn't go up. You go in the positive direction. Okay, let me demonstrate the other situation also when the microscope comes down. Okay, so you slowly move it 2 or 3 turns, then leave, it's still going up. So again, this I would like them, you can specify 2 or 3 of your staff members so they can practice this. Because this is the common complaint we have.
Yeah.
Because somebody comes, cleans, then they, when cleaning, this is disturbed. And,
So,
and the doctor
nurse
comes,
in each clinic
should know
Here's
how
what
to
this-
do this.
But-
Because this is,
So you and who's working?
from my
Fatima.
experience,
Fatima.
it's the balance and how to change the lamp. Otherwise, this microscope never gives you any trouble. Unless somebody
Don't worry,
hits-
I know that for a fact. It doesn't give you trouble. It's the light
It's-
and
yeah.
the balance. He's absolutely right.
This is a problem.
So whenever you hear me and Moyed or Abdullah complaining about the microscope, say balance. Okay? Say balance.
Yeah. Because this is the problem we faced in Kuwait. Sometimes over the weekend they become very active cleaning and they turn this knob. On Sunday morning doctor comes and complains the microscope is not balanced and it upsets.
But it takes time to balance.
Yeah. That's why I want somebody. See, now it is standing, but still you have to check it in each position, 2 or 3 positions. So it's
to make
still-
sure.
Now the other situation is, suppose this is overcompensated.
It's dropping.
Yeah. See.
Okay.
In the other, you saw it moving up. That time you have to move in the opposite. Now you move the balance in the opposite direction. This is simple, but this is the one which will give you trouble. And the other, you can see there's a knob here. These are the friction knobs for this movement. And this is the balance for this axis. Suppose I loosen this. Okay, right now it is balanced. Sometimes, let me try, can I cheat? See. Now wherever the doctor leaves the microscope, it is balanced. Let me disturb it. See, now if you leave, it is returning back to this position. I want to keep the microscope straight. You can see the weight is not compensated properly. So that is done, this weight compensation is done out here. You turn this until it's like the doctor doesn't feel the weight of the microscope in his arm. It should be like feather light. It's not the doctor struggling with the microscope. It should, yeah. This you'll have to practice it individually to understand what I mean. Right now, see, if I leave, I cannot feel the weight of this microscope in my hand. If this is not balanced, who will be practicing this? I mean, you're going to try. Just try using the microscope. No, just the movement. Okay, and let me disturb and let me change this. Okay, now try. It'll be better if you try. See, you can find the weight has increased. So we compensate. Yeah, the weight. It's like it's struggling against. So if this is balanced,
should be further right.
Yeah. Like, you shouldn't feel the load of the microscope in your hand. And then this is the friction now, just to tighten this. Also, this is important. Now, wherever we leave the microscope, it stays. Okay? Let me do. Now you can try the weight in this position. You find it heavy. Yeah. In this case, what you do is right now it is balanced. So, see, this moves. In this position, it is not balanced. You can find the way. So you have to align this arrow to point to this notch, this mark. See, right now when I move this is moving independent of this. Whenever this happens, it's like not balanced properly. Okay, this particular axis. So you move this until it's aligned, and then press number 2. Yeah, you can hear a click. Okay, and then see, right now this is moving along with this. That means the weight here and here is balanced. You want to see it again? I'm just removing the balance out. Okay. Now you can see this is moving independent of this. Okay. That time you feel more weight. See, and then if I leave this, the microscope is not balanced. So bring it, align to this. Just answer Aslam. Tell we are in the